Welcome everyone. Thank you for joining us today for the Suicide Talk webinar. My name is Vera Salzburn. I am Project Manager at Chatham County Safety Net Planning Council, and I am also an ASSIST trainer. ASSIST is an acronym for Applied Suicide Intervention Skills Training. Joining me today is Lindsay Braden. Lindsay is a certified ASSIST first aid responder and an AmeriCorps Vista. We are here today with our Prevent Suicide Today program. We have been working in Chatham County, Georgia since 2017 in partnership with Gateway Community Service Board and other diverse community partners. Together, we are implementing international evidence-based trainings. One of them is Suicide Talk, which is the topic of our discussion today, and the other is Assist, which is a 2-day skills-based workshop. We'll spend more time talking about Assist at the end of our webinar today. We are glad and thankful that you've joined us today for the webinar. I'm sure that there are people listening for a variety of reasons. Some of you may want more information about suicide prevention in our community. Some of you listening may be worried that you or someone you know may be at risk of suicide. I'm sure that there are some of you who have been impacted by suicide. This session is aimed at our entire community because we think that by working together, we can prevent suicide together. It is our goal for everyone to know that help is available and where to find it. Also, in the end, if we have time left, we can answer some of your questions. So please, if you have any questions, submit them throughout the presentation and we'll try to address them at the end. So Suicide Talk is about dealing openly with the stigma around suicide. It focuses on the question, should we talk about suicide? By looking at this question in a number of different ways, we hope that we can help you discover some of the beliefs and ideas about suicide in your communities and in yourselves. As Suicide Talk participants, you will learn how suicide is a serious community health problem and how it impacts our entire community. Together, we will explore how personal and community beliefs about suicide affect suicide stigma and safety. And we will learn how to take the first steps to help prevent suicide and create a suicide-safer community. We are talking about suicide today. So if at any point throughout the session you will find yourself having thoughts of suicide or need immediate assistance, please call the Georgia Crisis and Access Line at 1-800-715-4225.
So let's begin by looking at some of the national statistics, which speak quite loudly and help us better understand the impact of suicide on communities at large, as well as on individuals. First, we'll look at the big picture, the national data on suicide, and then gradually we'll narrow it down to the state and Chatham County level. According to the latest report by the Centers for Disease Control and Prevention that was released in June of this year, suicide rates have been rising in nearly every state. And in half of states, suicide rates went up more than 30% since 1999. In 2016, nearly 45,000 Americans aged 10 or older died by suicide. Suicide is the 10th leading cause of death and is one of just 3 leading causes that are on the rise. The conservative estimate is that for every death by suicide, 25 or more people attempt. In addition to the tremendous emotional cost of suicide, there's also an economic impact in medical costs for individuals and families, lost income, and lost productivity for employers. Suicide is estimated to cost the U.S. $69 billion annually.
So also, while we're talking about the national statistics, we thought it would be important to include the following slide describing suicide rates among the youth. So a few things that we'd like to highlight from the most recent CDC report is that in 2017, over 17% of students had seriously considered attempting suicide. Almost 14% of students had made a plan about how they would attempt suicide, while 7.4% of students had actually attempted suicide one or more times. Female students were twice as likely as male students to have seriously considered attempting suicide. And also, about 1/3 of students had felt so sad or hopeless almost every day for 2 or more weeks in a row that they stopped doing some usual activities. Lesbian, gay, and bisexual students seriously contemplate suicide at almost 3 times the rate of heterosexual youth.
Now let's take a look at the Georgia statistics. The suicide rate in Georgia has increased 16.2% since 1999. Over the last year, there were a total of 1,409 reported deaths by suicide. I emphasize the word reported because sometimes, in cases where it might have been suicide, the cause of death was actually unclear. Suicide is the second leading cause of death for ages 25 to 34, and the third leading cause of death for ages 15 to 24. Last year's statistics indicated that suicide was the third leading cause of death for ages 10 to 24. Also, in Georgia, twice as many people die by suicide as by homicide, and nearly as many people die by suicide as by motor vehicle accidents. On average, one person dies by suicide every 6 hours in Georgia.
So now let's take a closer look at Chatham County. This is the community we have launched the Prevent Suicide Today program in, and let's see how it has been impacted by suicide. It is estimated conservatively that in 2016, almost 1,200 people attempted suicide in Chatham County. Reportedly, 47 people died by suicide. This compares to 54 deaths through motor vehicle accidents and 52 deaths by homicide in Chatham County. Among those who lost their lives to suicide, there were twice as many males as females, and 2 individuals were between ages 10 and 19. Each of those 47 individuals had family, friends, co-workers, and others who were impacted by their death. Suicide impacts us all as a community, and these numbers, these people, these lives tell us that we as a community have a lot of work to do in suicide prevention. So let's take a moment and reflect on suicide's impact in our own lives by thinking through these few questions. Do you know someone who died or might have died by suicide? Do you know someone who injured themselves with suicide in mind? Do you know someone who has or had, or whom you now suspect has or had thoughts of suicide? And also, do you know someone, including you, who is or has been personally impacted by suicide? I have to say, in our Prevent Suicide Today work in the community, we see that for many people, the answer to these questions is often a yes. It may be for you as well.
Every single suicidal act has a lasting impact on those left behind. It's very likely that over our lifetime, all of us will be touched by suicide in one way or another. Just recently, many people felt the impact of suicide when the news reported the deaths by suicide of Kate Spade and Anthony Bourdain. Now, what does that say about suicide? One of the things it says is that suicide can affect people from all walks of life, and it could happen to any of us. Acknowledging this helps us better understand the value of speaking openly about suicide. When we recognize the potential for suicide in everyone, in our coworkers, classmates, friends, family members, and even ourselves, then we're more likely to do something to help prevent it. Later in this session, we'll provide you with more information on how you can help prevent suicide in your community.
So before we talk about prevention methods, we thought it would be important to discuss some ideas associated with those at risk that are actually false ideas and misconceptions about suicide. So while there are a lot of myths about suicide, we would like to highlight just 5 common misconceptions. So misconception number 1, people who talk about suicide won't really do it. This is actually false. According to research, as many as 75% of people who attempt suicide do or say something to indicate their state of mind and intentions before they act. Talking about suicide may simply be a plea for help for those people.
Misconception number 2. Anyone who tries to kill him or herself has a mental health condition. This is false. Research shows that 54% of people who died by suicide actually did not have a known mental health condition, such as depression.
Another misconception is that talking about suicide may give someone the idea. This is actually false. Research confirms that asking someone about suicide will not put the idea in their head. In fact, many people having suicidal thoughts often feel relief when someone asks them about it. Talking about the possibility of suicide can be a first step in obtaining help.
Another misconception is that people who die by suicide were unwilling to seek help. This is false. Studies show that more than half of suicide victims sought professional help within 6 months of their death. On a side note, as we're talking about suicide in the community, to help focus on the person rather than on their action, we say that a person died by suicide instead of saying committed suicide.
Yes, thank you. And the final misconception we're going to discuss is that if a person is going to attempt suicide, nothing will stop them. This is something we hear people say, and this is false. Most who attempt suicide remain uncertain of their decision until the final moment. Most suicidal people don't wish for death. Really, they just wish for their pain to stop. So to help someone at risk of suicide, we need to separate myths from facts. That's why it is so important to recognize these misconceptions. And the truth is that people who attempt suicide are in pain, whether it is emotional, physical, financial. They don't see a way out of their pain, so they feel overwhelmed. They feel lonely and hopeless. As suicide talkers, our goal is to offer hope and show that help is available. To do this, we need to talk about suicide, which may be uncomfortable. So what we like to say is, let's get comfortable being uncomfortable. For many people, suicide is that S word that they just tend to avoid. As a society, we resist talking about suicide for many different reasons. It could be shame and stigma. It could be the heaviness of the subject. It could be the result of a personal experience. Or it could even really be unconscious. Many people avoid talking about suicide without really realizing it. So why should we talk about suicide? Well, because talking about suicide is an effective way of preventing it. By opening the dialogue, sharing our stories, and identifying resources, we can reduce stigma and make it easier for people at risk of suicide to come forward and get the help they need.
So our goal today is to become suicide talkers. Being a suicide talker means speaking openly about suicide in a comfortable and thoughtful way. When a sign like this is displayed prominently in our homes or workplaces or communities, it makes others more willing to talk with us about suicide. Our attitude can do this as well. Do you think that a person at risk of suicide would want to share their thoughts with us if our attitude is, "Why do you want to talk about this? This is wrong"? Probably not. A person at risk of suicide is more likely to talk to us when we show that we're comfortable, respectful, and willing to talk about their thoughts and feelings about suicide.
So sometimes we think of talking about suicide in terms of rights. A person having thoughts of suicide may be wondering, do I have the right to involve someone in my problems? Do I have the right to ask for help? While a person who wants to help may be questioning, do I have the right to put my nose in someone else's business, or do I have the right to ask about suicide? The truth is that most of the time, talking opportunities are not about the right to privacy, the right to non-interference, or the right to seek or give help. In fact, they're not about rights at all. They're about needs and invitations to meet those needs. A person at risk is a person in pain. They want others to notice it. So they send out invitations to talk openly about it. As a person who wants to help, you receive those invitations and you have to decide whether or not you're going to accept them and act upon them.
These invitations we're talking about are also known as warning signs. Most people who take their lives exhibit one or more warning signs, either through what they say or what they do. It's important to look for changes in behavior or the presence of entirely new behaviors, especially when they're related to a painful event, loss, or change. So some common warning signs include a sense of hopelessness, isolation, aggression and irritability, possession of lethal means, feeling like a burden, drastic mood changes, frequently talking about death, self-harm, engaging in risky behaviors, making funeral arrangements, giving things away, substance abuse, direct threats of suicide, and low self-esteem. So now we're going to shift our perspective from the helper to the person at risk and discuss the needs of someone thinking about suicide. We can remember these needs using the acronym TALK. T stands for tell. As a person thinking about suicide, I need to openly tell someone about my thoughts of suicide. I might like to tell several people. I'm aware that I may be cautious in saying it as openly as I want to, and I will be watching for reactions.
So why would a person at risk tell anyone what they're thinking? If they really wanted to die, why tell someone that might stop them? There really seems to be only one possible answer, and that is part of them is still unsure about death. They are undecided, and the mere fact that they're still alive says that they have a connection to life. A person who wants help and cannot decide really has a need to reach out for someone to talk to. If you are having thoughts of suicide, or if you think you ever could come to that point, there is one very important thing you can do to help yourself. Don't face suicide alone. Tell someone. Tell several people. It's always better. By demonstrating that we're comfortable and willing to speak about suicide, we make it easier for the person at risk to meet their need to tell.
A stands for ask. As a person thinking about suicide, I need someone to ask. Once I have given you any reason to think that I might be thinking about suicide, please ask me specifically about suicide. Ask me as directly, clearly, and as soon as you can. Right now, that is exactly what I want you to do.
So even when invitations are obvious, some people may still avoid direct talk about suicide for fear that it's just too personal or asking about it is too directly. But asking about suicide is truly a win-win situation. If thoughts of suicide are present, then we know exactly what we're dealing with. However, if they are not thinking about suicide, now they know that you are someone who actually cares and someone they can talk to. Asking directly about suicide means exactly that. Just asking a person, are you thinking of suicide or are you thinking of killing yourself?
L stands for listen. As a person thinking about suicide, I need someone to listen. I hope that you're a good listener. I hope you will listen to what I need to say and not to what you might like me to say. I may not have really talked to anyone before about suicide, and I need to clear my thoughts by talking through them.
Can you sense how alone a person thinking about suicide might feel? Now think about them being alone and having to make this life or death decision. Let's explore how much of a difference it can make if the person at risk can remember some of their strengths and some reasons for living, sort out some priorities, and just make a commitment to stay alive, at least for now. Almost all persons at risk have not fully decided that they want to die. Instead, they want to talk to somebody about their feeling of not wanting to live. People at risk can often talk themselves out of acting on their thoughts of suicide. As long as you listen and keep the conversation going, you help meet their need.
Finally, K is for keep safe. As a person thinking about suicide, I need help keeping safe. I may not know what to do. Can you help me think about what needs to be done? Can you help me avoid dangers that I may not fully recognize?
So yes, people at risk of suicide often feel so overwhelmed. They may feel that they have a lot to deal with and they just don't know where to start. The person at risk needs someone who understands that the first priority is safety from suicide and that everything else is just secondary. This basically translates into something like this. Yes, later you can think about that or work on that, but today let's just focus on XYZ and on whatever we need to do to keep you safe. This perspective includes understanding that any means of suicide should be removed whenever possible. It also means that thoughts of suicide cannot be kept secret. A helper should never be the only helper. So let's review the needs of the person at risk and how we can help meet those needs.
I need to tell someone about my thoughts of suicide.
I am alert to your needing to tell me.
I need someone to ask me about my thoughts of suicide.
I am willing and able to ask you directly.
I need someone to listen to my thoughts and feelings about suicide.
I am willing and able to listen to your thoughts and feelings about suicide.
I need help keeping safe from suicide.
I am willing and able to help you keep safe. So please just note that this is not a comprehensive intervention model. This is just an illustration showing that it is possible to meet the needs of the person at risk, and that by doing so, it is possible to prevent suicide. In addition to the TALK acronym that we just discussed, and as a summary of our presentation, We'd like to share another resource for suicide prevention. This simple 5-step guide is an effective tool supported by evidence in the field of suicide prevention. So let's just go over each step. Step number 1, ask. Ask the question, are you thinking about suicide? It just communicates that you're open to speaking about suicide in a non-judgmental and supportive way. Step 2, keep them safe. So after the ask step and after you've determined that suicide is what in fact we're talking about, it is important to find out a few things to establish immediate safety. Have they already done anything, trying to kill themselves before talking to you? Does the person experiencing thoughts of suicide know how they would kill themselves? Do they have a specific detailed plan? What's the timing for their plan? What sort of access do they have to their plan methods, and so on? Step number 3, be there. This could mean being physically present for someone, speaking with them on the phone when you can, or any other way that shows support for the person at risk. 4th step is help them connect. Helping someone with thoughts of suicide connect with ongoing supports such as Lifeline can help them establish a safety net for those moments they find themselves in crisis. And the final step is follow up. So after your initial contact with the person experiencing thoughts of suicide and after you've connected with them to the immediate support system, just make sure to follow up and just see how they're doing.
Effective suicide prevention requires multiple approaches and resources. Knowing your resources can help you take effective action and is key to creating a suicide-safer community. So right now on your screen, you can see a few of the resources that we would like to discuss. First, the Georgia Crisis and Access Line, also known as GCAL. This is a 24/7 hotline for accessing mental health services in Georgia. It's run by the Georgia Department of Behavioral Health and Developmental Disabilities. You can call GCAL at any time, any day of the year. And GCAL professionals can provide crisis intervention services over the phone. They can dispatch mobile crisis teams, and they can help individuals in finding an open crisis or detox bed across the state. They can also link individuals with urgent appointment services. Also, in non-emergency situations, GCAL can help you access a state-funded provider in your area. Another resource is the Georgia Crisis Text Line. It is also a free 24/7 support for those in crisis. Simply text the letters GA to the number 741-741, and you'll be connected with trained counselors in Georgia. This is an especially great resource for anyone working with youth that might feel more comfortable texting. The National Suicide Prevention Lifeline is a national network of local crisis centers. It provides free and confidential emotional support to people in suicidal crisis or emotional distress. It is also open 24 hours a day, 7 days a week. They also have a chat option available through their website. Finally, the Veterans Crisis Line is the same phone number as the Lifeline, but you'll choose option 1 when you dial that number. We strongly encourage you to program these numbers into your phone so that you can be a resource in your community. Also, on our Suicide Talk webinar webpage, we have a resource flyer available for download. It's called Helpers in Your Community and includes resources for Chatham County and national hotline resources. As a follow-up to this webinar, we'll be sending out an email with a link to this page. And of course, please let us know if there are any other resources you think we should add to that list.
So as we're talking about building a suicide-safer community, we think that it's important to talk about things we can do to promote our own mental health and well-being. The current slide describes some of the things that may be what we call life sustainers. It may mean different things for you. Some of you may sustain your life by doing your favorite activities, spending time with your family, eating your favorite food. For those of us here in Chatham County, It could be going to the beach. Whatever it is, we encourage you to take time for yourself and do the things that you love.
In just a few minutes, we'll be ending our Suicide Talk session. So yes, Suicide Talk is about talking openly about suicide, but it's also about walking the talk and representing our words with actions. So let's think of some things that we can do as community members to walk the talk and help create suicide-safer communities. So here are some ideas of things that you might do. You can practice caring for yourself and asking for help when you need it. You can volunteer to tell your story about suicide. As we've discussed today, many of us have likely been impacted by suicide in one way or another. And sharing our stories and experiences lets others know that it's okay to talk about it, and it helps them share their own stories. You can also help identify community resources and share those resources with others. As we mentioned earlier, please feel free to use and share the resources from our website. Also, depending on what you do, you may be able to influence policies and procedures at your organization with regards to suicide prevention. Finally, you can sponsor, organize, or support a training.
So particularly for those of you in Chatham County, there are a couple of opportunities available through our Prevent Suicide Today program. If you liked today's presentation, you can invite us to your organization, and we'll be happy to present a free suicide talk to you and your staff. It can be at your staff meeting or through Lunch and Learn. It can be as short as 20 minutes, or it can be a full hour-and-a-half session. And for additional skills, you can attend an applied suicide intervention skills training workshop. So let's spend a bit more time right now talking about this workshop called Assist. So what is Assist? Assist is a 2-day interactive workshop in suicide first aid. It teaches participants to recognize when someone may have thoughts of suicide and work with them to create a plan that will support their immediate safety. It is listed on the National Registry of Evidence-Based Programs and Practices, and it is proven to be effective in preventing suicide. At the Assist workshop, you will explore how your own beliefs and experiences can affect your ability to help someone. You will learn to recognize suicidal thoughts and behaviors and to respond with a life-saving intervention. You will also learn how to create a safety plan with a person at risk to keep them safe for now. And you will learn how to connect the person at risk with other resources to keep them safe in the future. Also, Assist workshop includes role-play activities, which allows you to practice the steps of the intervention model. Anyone 16 or older who interacts with suicidal individuals can benefit from this workshop. So our Chatham County Assist team has 20 Live Works trainers committed to reducing suicide in our community. Each workshop is led by at least 2 trainers. The trainers come from different partner organizations, including Gateway Community Service Board and Savannah-Chatham County Public School System. So the workshop costs $125. Our true cost to provide this workshop locally is over $250, but thanks to the support of the Chatham County Commission and other community partners, we are able to offer these workshops at a reduced price. Also, we have need-based scholarships available for community members living or working in Chatham County. So for more information about scholarships, just feel free to call us at 912-661-1456 or email us at assist@chlink.org.
We mean it when we say that Assist is for everyone. Although Assist is widely used by healthcare providers, participants do not need any formal training to attend. Ultimately, Assist is founded on the principle that everyone can make a difference in preventing suicide. The more people in the community who have suicide intervention training, the more likely it is that they'll be able to identify someone at risk and intervene to keep them safe. With our skills training program, we hope to reach school coaches, community grandmothers, the business community, veterans in the military, faith leaders, bartenders, healthcare professionals, and really anyone who interacts with others. For example, in one of our recent workshops, we had a farmer, a mother who just wanted to know how to help her children, a mental health clinician, a pastor, a social worker, and a student, just to mention a few. It's groups like this, coming together to learn new skills and learn from each other, that help us build a suicide-safer community.
All right, so as we're concluding our Suicide Talk, we would like to thank all of our community partners for making this program possible and for working together to prevent suicide in Chatham County. We couldn't do it without them. So, okay, we have a couple of minutes left, and we don't have a whole lot of questions, but let's look at some requests and questions that we did receive. So someone is asking, are you able to send us a copy of presentation? Yes, in fact, we are recording this presentation. It will be available on our website, on the webpage, on the Suicide Talk Webinar webpage. As soon as we get it all situated and set up, we'll send everyone an email with a link to the page that will have the presentation there. And that's it. It looks like we don't have any other questions. So again, we'd like to thank all of you for joining us today for today's Suicide Talk webinar. Feel free to contact us with any questions and comments about Suicide Talk and Assist. You see the contact information is on your screen. We will be sending you a follow-up email with more information about our programs, as well as a link to our webpage with the resources. Please follow us on Facebook and Instagram. And again, thank you so much. Have a great day. Bye-bye.